Thank you again for tuning in. Next week marks 2 years since the beginning of the COVID-19 pandemic. On March 5th, 2020, the first 3 cases of COVID-19 in the state of Maryland were identified in Montgomery County. Throughout the next month, the county will take time to remember those who have died from COVID-19 and recognize the many residents and organizations who helped save lives over the last 2 years. While the response to this pandemic is not over, this month-long recognition effort will also look back at all we've done over the last 2 years and thank those who've helped get us to where we are now. Each week throughout the month-long event, we'll focus on a different theme. Next week will be our Memorial Week. From February 28th to March 6th, we'll remember the nearly 2,000 residents who lost their lives over the last 2 years. And we are encouraging Montgomery County residents to share their stories using the hashtag #MoCoRemembers. I hope you can join us for a vigil that will be held next Thursday, March 3rd at 7 p.m. at the Marion Friar Town Hall Plaza in Wheaton to honor them. Due to the incredible work of this government, volunteers, and partners, Montgomery County has achieved among the highest vaccination rates and the lowest case rates for a jurisdiction of our size and diversity anywhere in this country. Most importantly, we're saving lives as our county's death rate from COVID is nearly 1/3 lower than the national average. We'll continue to use what we've learned over the last 2 years in our ongoing response, monitoring the situation regularly and continuing to do everything we can do to reduce the risk, including encouraging vaccinations and getting boosted. March will be a time of remembrance and reflection of the loss and hardship, as well as renewal of our resolve to end and recover from this pandemic. This week, our case rates have been hovering in the mid-70s per 100,000 residents. We currently remain in the CDC-defined category of substantial transmission for the second week in a row. Our test positivity rate did drop as well, and we're about 1/3 lower than the rest of the state test positivity rate. And hospitalization and deaths also continue to decrease. Although we have made great progress over the past month, we're still seeing higher rates than last fall. And with the proliferation of rapid take-home tests, many active COVID cases are not being reported to either us or the state like they used to be. Take-home rapid tests have been a great help to our residents, but they also make it harder for us to figure out how prevalent the virus is in our community. So I encourage all those who test positive on a test to please report the positive cases to us or the state. It's very important for contact tracing to know who's been infected and where the cases are. And it's our best effort to mitigate and contain the spread of this virus. This week, the indoor mask mandate in Montgomery County has been lifted in accordance with a decision by the County Council. Nevertheless, I'm going to continue to wear a mask generally in indoor public spaces because wearing a mask, as well as being fully vaccinated and boosted, are the best ways to reduce the risk of transmitting and getting COVID-19. It's also important to remember that businesses and other organizations can continue to require their customers or visitors to wear a mask in their establishments. The county is also strongly recommending that front-facing staff who have not received their booster in particular, and visitors in county government offices and facilities continue to wear a mask or face covering in publicly accessible areas. We'll continue to monitor the situation, and if there should be another surge, based on our experience over the last 2 years, we know what we need to do to reduce the risk. The lifting of the indoor mandate from the Board of Health does not change the mask requirements of Montgomery County Public Schools. The Maryland State Department of Education and Montgomery County Board of Education set the policy for public schools in the county. Removing the mask requirement throughout our school buildings at this point would probably be premature unless the county was clearly at or below a moderate rate of transmission, which we're not. And even then, masks should be highly encouraged. I do think we're going to get to the point where masks can more safely be optional, but if we're still in substantial transmission as we are today, we're really not yet there. I think we also need to take into consideration guidance from the CDC. The CDC found that COVID rates dropped in schools that required teachers and staff to wear masks. In 2021, COVID-19 took the lives of 539 children in the U.S., most of which happened in the second half of the year. With so many students still unvaccinated, we should continue to be cautious and consider the health and safety of our children, staff, teachers, and administrators in our school. We've worked very hard with MCPS to reduce quarantining, and I'm concerned that by removing the masks prematurely, we could unnecessarily increase the spread and potentially impact learning loss of our students. I also want to say that in the beginning of this, we know that people who were older tended to be the primary population group that suffered from COVID. Something has changed since then, and Omicron has been a bit different, and now we see much higher rates of cases in the younger population than we saw in the beginning. So that's important to take into consideration, and it's also important to take into consideration that not all the bad effects from COVID are getting seriously ill and dying. One of the major effects has been long COVID, and they're still doing research on it and trying to determine how much of the population is experiencing it. But we do know that there are some serious side effects from long COVID, and we need to protect people not just from getting very sick and dying, but also from getting cases of COVID that could have long-term impacts on their health. Despite our overall high vaccination rates, vaccinations and boosters continue to slow down. Currently, only 51.5% of county residents have received their booster shots, and this number is increasing very slowly, too slowly. Being boosted reduces the risk of death by 1/3 compared to being fully vaccinated, and it greatly reduces the rate of hospitalization. And before Omicron, unvaccinated people were 15 times as likely to be hospitalized as were fully vaccinated people. With the Omicron variant, the biggest difference was between the boosted and the unvaccinated, which are 7 times as likely to be hospitalized. Getting boosted is the best protection we have to reduce severe symptoms and deaths. It's important to remember that when we got our first 2 shots of the vaccine, we were told that it was likely we were going to need booster shots. Now we know that over time, the effects of those first 2 doses has waned. And we also know that getting a booster shot restores a level of protection roughly similar to what we had when we got our first 2 shots. So if you're past a few months beyond your last booster shot, beyond 5 months, then you need to consider getting the booster, because you're going to be more vulnerable to getting sick and more vulnerable to getting more seriously sick. The booster is your best protection, not only against catching it, but if you do catch it, it's protection against getting a severe case. Earlier this week, I testified at the General Assembly in support of Delegate Janelle Wilkins' just cause eviction legislation. This legislation would authorize local governments to enact legislation that would require a landlord to have a good reason to terminate a tenant's lease. I know of too many tenants who've had their leases terminated simply because they complained to the housing department about roach infestations or non-working appliances. Tenants have a right to safe and decent housing, and we have a responsibility to protect that right. I was also pleased that the Maryland Association of Counties agreed to my request to support this important piece of legislation. Delegate Wilkins, tenant advocates, and I have been working for years to pass this, and I hope this is the year that it finally passes. Throughout this month, we've honored Black history and highlighted our work on equity and inclusion while recognizing and identifying challenges that continue to remain in our society due to systemic racism. On Monday, we will conclude Black History Month this year with an important bill signing ceremony that will officially begin the process to rename the Silver Spring Library for former Tuskegee Airman, Brigadier General and Montgomery County resident Charles McGee, who passed away last month. General McGee was an American hero who, despite facing prejudice and discrimination his entire life, he was committed to serve his country just the same and sacrifice his safety for our freedoms. General McGee was honored throughout his life with numerous accolades, ranging from a Medal of Honor and the Distinguished Flying Cross to being profiled in featured films and flipping the coin at the Super Bowl. His legacy in Montgomery County will be appropriately remembered and honored at one of our more prominent libraries, a building that provides the tools and resources enabling future generations to soar in his footsteps. I want to thank Councilmember Jawanda for proposing this bill, and I invite you to joining us at this important community event next Monday, February 28th at 11 a.m. Thank you for tuning in again, and have a great week.